I recently had an encounter with an expert in the mental health field of family scapegoating abuse. And it was very disturbing. I had joined this person's Substack, and after 3 days of interacting, filling out my profile and all, I sent her a direct message, a private message, asking her if she had any colleagues in my area, because I lived in a different state, asking if she had any colleagues in my area that I could reach out to for support. She came back with, "Have you read my book?" And I'm like, what? And I said, "Did you read my message?" And she came back all snarky and said that she's under an undue amount of stress because her fiance is in the hospital. And I said, "I'm sorry to hear that. But if you're really under an enormous amount of stress because you have a close one, a loved one in the hospital, you might want to think about putting your social media account on vacation mode." And she took offense to that. She copped an oppositional defiant disorder type of attitude, as if I was trying to tell her what to do, tell her how to run her account. And I was summarily banished. I was banned. My paid subscription was revoked. And then she went and posted she made a blog post about me, not naming my name, but the post was obviously about me. And it was an article, an essay about how therapists need to protect themselves, and that they appropriately needed to protect themselves from covert narcissists who infiltrate support groups. And she went on to say that she had to do this recently and that she banned the person and refunded their subscription. Well, she didn't have to name the name. I was the only new member in the past 3 days, and the only new member that magically disappeared. So everyone in that group who had interacted with me knew who she was talking about. You know, a mental health professional cannot diagnose narcissism with one direct message encounter. Diagnosing someone as narcissistic requires screening tests, assessment tools, and likely weeks, if not months, of in-person, face-to-face interviews. Yet this expert went on a smear campaign against me after one private direct message encounter in which all I asked was one simple question: "Do you have a colleague in my area?"